Hi everyone, it's nice to be with you for this lecture on international mental health. My name is Amanda Irish. I'm faculty at the University of Iowa, and this is going to be hopefully about 30 minutes overview of international mental health. Certainly, if you have any questions, please feel free to reach out. My email is here, and we will get started. My first disclosure, which isn't on the screen, is that this is the first time I have ever recorded a lecture on PowerPoint. We'll see how the video and the sound comes out. If there are any issues, please reach out, and I'm happy to clarify or re-record anything that might be wonky. But to get into this, of course, this is a huge topic. And there's no way that we can cover kind of the entire spectrum of international mental health, which, mental health in its own right is a big topic, and an international take on that is going to be very limited. The other thing I wanted to just put out there is that there are some graphic photos, nothing gratuitous. Anything that I have included, I have de-identified to protect vulnerable persons, but there's still some problematic issues in terms of depicting some of the struggles of the mental health landscape and persons who are dealing with those kinds of issues. So those are just some initial disclosures, but we'll see, how much we can kind of cover in an overview in the next 30 minutes or so. And so objectives really, just to kind of introduce the topic, of course, you've gotten my disclosures, really looking at the global burden of disease, and then using determinants of health and disease as a framework for how to kind of approach this very large topic. And then what are some future steps or intervention opportunities. And, this is really very limited, but will provide some ideas based on those determinants of health, that framework, to allow you to conceptualize the different ways in which we can impact these issue areas. So, why take the time to talk about this topic? Is this something that is very important? Well, yes, according to the WHO, about an eighth or nearly 1 billion people are currently living with a mental health disorder. And we'll break down some of the different ones, but I'm sure from your training you're familiar with the full spectrum of mental health disorder. But of course, anxiety and depression are most common, something that many of us struggle with. That's not unique to us in the United States. Of course, that affects all people on the planet these days. A lot of the reasons are what you'd expect based on your own experience of ups and downs in life and hardship. But we have data that indicates that the prevalence has been increasing since the 90s. And of course, nearly 30%. 2020 and beyond due to COVID. And those of us who were working in the hospital system during that time still have very vivid memories of, those patients coming in and some post-trauma from that. Of course, as with any health issues, access and stigma are really the primary impediments to good care. And then this is just kind of showing you what the distribution is. Of course, we already talked about depression and anxiety being the most common, of course. This is data from 2020, so pretty recent, looking at, substance use and abuse, schizophrenia, bipolar, certainly less common as we experience it, developmental disorders, which may have a mental health component, behavioral disorders of children, and then there's the other category. Maybe there's dual diagnoses, maybe there are some kind of gray areas where it's difficult to differentiate the primary mental health diagnosis. So this is really kind of the meat or the map of kind of what we're talking about today. So looking at the different mental health issues and how the environment contributes to them. I thought the best way to break this down was really to look at the demographics, economic impacts, the community or neighborhood level, environmental, social, and cultural. And of course, there are overlaps between these different things. You know, when you look at demographic, there's community diversity. How is that substantially different from your neighborhood? You know, where you live is impacted by the environment, of course, by social and cultural issues. But we have to find a way to kind of break this down. Otherwise, it's just this like overwhelming kind of blob. Um, but these are all things that we recognize from just the general like socioeconomic contributors to general health rate. So I think it's not a surprise to those of us kind of on the younger end of the spectrum, and certainly all of you who are listening to this, you know, mental health and physical health are really two sides of the same coin. And so general full holistic care who, you know, that focuses on the whole person is really the aim here. So of course, it's the same kind of inputs and outputs and factors that contribute to limitations or, you know, impaired delivery of mental health care. You know, of course, it's just the same as what we see for those limitations in physical health care. And so this is our roadmap. As I mentioned on the last slide, the demographics, economic, geographic, environmental, societal, and then throwing in kind of the medical component of that, which is really all encompassing and really has to deal with the way that our healthcare system identifies or in some way stratifies mental health from physical health or the health of the whole person. And so looking, you know, very briefly at demographics, I don't want to bore you with statistics. I know when somebody starts giving me lists of numbers, I kind of zone out. But, you know, of course, the highest global prevalence is not shocking to you all, is younger folks 20 to 35. They're kind of the job force workhorses, you know, having families, a lot of social stressors. This is when, you know, issues of underlying mental health, substance abuse issues, bipolar, schizophrenia start to maybe be uncovered. Women have a greater prevalence to men, that is 2 to 1. Of course, there are issues of gender-based violence, how labor is divided in the household. Again, you know, mentioning mood disorders and substance abuse disorders. There may be differences there between men and women, of course. We know from kind of our board study that older individuals who are, you know, not in a tight family system, who don't feel supported, those are all high risk factors for suicide and, of course, depression and other mental health issues. And that's really just the same everywhere. So, you know, looking at issues of gendered violence, and again, this is where some of those graphic photos come in. On the left here, this is a picture of Lacey Peterson, who you may remember from the media back in 2002. She was murdered while pregnant by her husband, which is not uncommon, unfortunately. This poor patient in the top middle here is a woman who was attacked by a machete by a scorned lover. This athlete here below was an Olympic distance medalist, Agnes Tirop. She was a Kenyan distance runner, and she unfortunately was murdered by her husband. And then we've got Robert Durst up here in the top right, if you've seen The Jinx on HBO, and OJ, who probably killed his wife, Nicole, in the 90s. And I show you this to really drive home the point that, you know, these issues of demographics in the way that violence impacts women is not unique to, you know, places like Africa or rural Asia, or really any place, this happens just as much in the US as it does in other places for the same kinds of reasons, right? For control of the victim. And I don't think I need to belabor that point any further. Looking at economic impacts, of course, issues of opportunity and stability. We know that a place where young people in particular are having difficulties making a living for themselves and providing for their families is going to cause economic strife, is going to cause depression. And certainly there is an impact of mental health issues and disease on the economic workforce itself. So if you are depressed or anxious, that is impacting your ability to be a productive member of society. And so when you have disability adjusted life years totaling 418 million, that's really 16% of all global disability. Of course, this has a huge impact on economic productivity. And when you have people who are socioeconomically depressed, this works further against development of local systems. And so when we look at the prevalence of mental health disorders, you see this darker green color, of course, in the United States, South America, Australia even. So, at first glance, you're like, oh, well, this seems to be that mental health disorders are more common in the kind of higher income countries, maybe some middle income countries, but it looks like sub-Saharan Africa is doing okay. And that's probably not actually the case. It's probably a lot darker green, and it's probably everywhere. There are certainly some limitations to our data collection, and I'll talk more about this in upcoming slides, but our data collection is very limited, especially when we don't have opportunities for people to present for care and to get a diagnosis of the thing that is, upsetting their daily existence. But even just looking at this, we talked about disability adjusted life years and the impact that has on economics. You can see this is a worldwide problem and is certainly going to impact individuals in each one of these countries and regions. And one person dies of suicide every 40 seconds. And for every person that completes an active suicide, there are more than 20 attempts according to data that we have now. And so you look at the removal of that person from society and looking beyond kind of the loss to the family, and the tragedy of a human life lost, but that also impacts the economy and the stability of the family and the community. And so looking again here at the suicide rate, and you could see something terrible is happening in Greenland. That is real data. I don't really know what that's all about. But again, you can see some very dark red in Russia and sub-Saharan Africa. And so this is probably a better scale for us. Again, limited by the quality of the data, but this is probably a better scale for us to show us where people are truly suffering. And then you can see in that white, is that, are those really, really low numbers, or are those areas of limited data capture? And I would argue that's probably more limited data capture than anything else. Of course, when we look at stigma, issues of misclassification and surveillance, looking at low and middle income countries versus high income countries, we know that there is reporting that indicates 80% of suicides in low income countries are documented compared to that in higher income countries, but there's a dearth of overall reporting. So like 15% only of research reporting is coming from these lower income countries. And not only is there this issue of lack of reporting, but there's a lag in the reporting. And so this is data from 2019. And so, there was this little thing that happened in 2020, COVID, that may also impact the way that this data is presented if we were to look at it today. And, full caveat, this is what makes this topic so challenging, is that, these low and middle income countries aren't monoliths. They have distinct cultural and structural environments. So we have to consider kind of the whole context, because there are so many similarities between, our daily experience in the US and then that of folks who live in, lower and middle income countries. So, important not to miss the fact that, these are sweeping generalizations, and each country in each region is going to have its own unique reporting and differences. And so looking here again, and I apologize, you see me looking up at my second monitor because the screen's a little bigger there, but you can see if you look at these darker kind of navy colored bars, low income countries, and in the middle two, you've got this blue and kind of teal color. These are lower middle and upper middle income countries. And you can see really for each category, it's those middle bars that really seem to jut out. No matter whether you look at depression, anxiety, bipolar, schizophrenia, eating disorder, autism, ADHD, conduct disorder, some kind of developmental disorder, or that, kind of catch-all other, there seems to be a greater burden. And again, I would argue this gray area, this higher income country, is likely due to better reporting when you compare it to what we see from lower income countries in that kind of navy color. I don't think that lower income countries are just lucky. I think that this is really due to limitations of data rather than prevalence. But certainly there are some sociocultural factors. People in lower income countries may not have the same processing of events as other folks. And so looking again here at suicide reporting, so this is the percentage of suicides that are reported. And so you can see they're primarily high income countries, but again, doing quite a bit of work in Africa, I can tell you that suicide does happen. And though, guns are not as prevalent, unfortunately, the rural community does still complete suicide. And what we've seen most commonly from my practice in Malawi is that people will ingest organophosphate pesticides to end their lives. And that is not something that gets reported very well within the local health system. And of course, if you look again here over time, you see that there have been some improvements, even in the high, middle, and lower income countries. Over time, there's certainly more capture. Maybe that also demonstrates the prevalence has increased from the 1970s, but that's really hard to kind of suss out. So looking at environmental, this is something I think that is increasingly causing those of us in the Western world some, consternation and anxiety, but this is very real for many people. If you look at the Indian subcontinent, you look at sub-Saharan Africa, issues of environmental degradation, extreme weather events owing to climate change, certainly ongoing conflict leading to disruption of typical society, issues of crowding, malnutrition, disease, all kind of rolling in and compounding upon each other. And then our, constant drive for technology leading to extraction of natural resources, labor practices, and pollution all certainly contribute to the mental health environment and cause impacts on overall wellness and the human condition. So this is the impact of Cyclone Freddy on Southeast Africa in 2023, you can see people's homes are ruined. These are mud floors, often thatched roofs you can see have caved in. Any gardens or agriculture has been wiped away. All of your clothing will be soiled, your health passport, your medications. This is going to cause severe turmoil. And this is not the kind of environment where people are doing well. And so the more you have to deal with this, and the already compromised you are in terms of your region where you live, the society that you live in, your ability to make a living for yourself, this all compounds into this greater picture of mental disease and lack of mental health. Again, it would not be a surprise to tell you that there are large proportions of people who are living in refugee camps like this one in Syria. Folks are struggling with post-traumatic stress disorder, with depression and anxiety. People want out of this situation. They want to have a better life for themselves and their families. People may be struggling with, suicidal ideation, substance abuse as an escape. So all of this stuff that just happens around the world certainly contributes to, mental illness around the world. Looking at the fronts of deforestation, I am sure most of you have at least heard there continue to be large swaths in South America where they're clear cutting and burning forests for resource extraction in an attempt to kind of build the local economy. But there are consequences to that, and you can see this changes the environment. It changes the ecological landscape. There may be food in this area that families can no longer utilize. There's issues of pollution, and then if you are struggling with asthma or lung disease, are you able to afford medication? Is that another way in which you're unable to provide for yourself that is causing an input into poor mental health? Of course, the resource extraction extends beyond adults to children. We unfortunately have child labor in Central Africa, cobalt mining. These kids here on the bottom right are doing some kind of farming work or resource extraction in India, and you can see these kids are really far too young to be doing anything like this. And then societal impacts, and this is maybe the one that we think of the most, or the one that we think maybe is the easiest of redirecting. This idea of prejudice or negative behaviors towards individuals with mental health disease, a belief that they're in some way suffering a divine punishment, or if they were just hardier, weren't so weak, they would be able to just get over it. And these are things we hear in our own culture, or the idea that somebody who is schizophrenic or bipolar, has some demonic possession, or even somebody who has like a migraine with aura or seizures is maybe compelled supernaturally. These things all kind of impact the landscape of mental health globally, and particularly in low and middle income countries. But again, we see this everywhere. And another thing that is a broad generalization, but is not so far-fetched in saying, is that in areas where it's not so accepted to present to the doctor and say, I'm just feeling very depressed, I don't take joy in the things that I used to, I'm not sleeping, I'm not eating, like all these typical diagnostic criteria for depression, people may come in And they do here too, right? It's like, I'm having the stomach trouble, I'm having these palpitations, I just don't feel right. So it may not be so clear. And that seems to be more common in lesser developed economies. And unfortunately, shackling is still globally very prevalent for people who have um, some of the more dramatic presentations of mental illness, those with schizophrenia, or those who have rapid cycling mania, or paranoia. Folks are unfortunately chained and caged, and you can see, this individual in the top right who is strapped to these boards, like he can't get up to use the bathroom. He's not able to make food for himself. He, of course, cannot make a living. And these folks are unfortunately really forgotten and tormented. Pardon me. And when, if ever, folks are, provided medications and released from these environments, it of course, damages their ability to trust the people around them. Aside from the primary reason they were restrained and shackled, this has huge consequences for their ability to move forward and rehabilitate. This is really, really very disturbing, and something we need to really continue to work on. In terms of providing treatment. Pardon me. So again, I mentioned that this idea of this magical thinking in terms of, how persons with mental illness are perceived. This is a survey done of 300 or so doctors in Nigeria. This is one of the wealthiest countries in Africa, and there are very prevalent belief biases about supernatural forces and personal failings. So like 20% of those surveyed said that the cause of mental illness is just that you were a failure as a person, you don't have good willpower, said 3%. Over half said that this was some kind of evil spirit or witchcraft or sorcery. Bad luck or destiny was 13%. God's will is 6%. Like, this is wild. And I think all of us know that this stuff is probably prevalent here in the US too. I didn't see any studies on this, but given what we've seen like during COVID and kind of the new resurgence in anti-vaccination, these kinds of like magical beliefs about what causes disease and how to impact disease are not as rare as you might expect for the educated. And that's looking beyond kind of just the average citizen, right? So there's tons of this stuff out there, and more food for thought when you consider like a person who is presenting to the medical system. There are biases about, who that person is and what is the best care for them. Because if you're already coming at someone and saying like, oh, like, this is your personal failing or this is God's will, like how readily are they going to be working to provide you with medication or therapy or those kinds of things. So, other issues, this was this kind of additional header that I added in of, what if you have a neglected disease? Like, what if you have leprosy or HIV and that changes the way that people treat you? Of course, that would cause you to feel a certain way, to be depressed, especially if, people push you into like a leper colony. That's really socially the same, or within the same realm of similarity as, being relegated to a cage or being shackled, I would say. And, we know that people who have mental health disorders have an increased risk of cardiovascular disease, obesity, diabetes, And so when you have mental health disease, you've got this increased risk, but then also how does the impact of, you know, coping strategies like tobacco, alcohol, drugs, of the recreational variety impact that whole picture, right? And then when we talk about that access to appropriate holistic care, you're looking broadly, focusing on lower income countries, because I think we have a good understanding of what healthcare looks like in the US or Europe. But, based again on my practice in Africa, it's like you're not going to show up and get an SSRI. Like that's not a thing that's available to the vast majority of persons. So, if there are NGOs that are focusing on mental health issues that are going to these communities, maybe they can do like a depot injection of an antipsychotic. But again, like, is that going to be able to be regularly scheduled? Is that going to change the way that the community addresses a person? Are they going to be unshackled? Are they going to be able to be, contributing member of society and somebody who is accepted? And of course, when we fail to treat that person as a whole entity, there are downstream repercussions for their health and their overall wellness. And of course, if we have prevalent neglected diseases beyond these, filariasis, leishmaniasis, rabies, even though that's not something that, is going to cause, rabies specifically is not going to cause somebody to behave bizarrely, it's something that gets considered in differentials. And so all of this stuff really changes the way that a person who is mentally ill is approached. And so just some pictures again to kind of drive this point home. People who have physical health problems may be shunned and develop issues of mental illness due to that loss of community, that connection, and poor care. They may suffer mental health degradation from the ongoing effects of the physical condition. So top left here, you've got a patient who has leprosy and gynecomastia, probably some cardiovascular risk factors. Bottom left here is an individual with vitiligo, which draws a lot of attention. I have friends that have this condition, and people are always asking them questions that are really inappropriate. This poor child has noma, and of course, people will be shocked and appalled to see something like this, but this is going to impact, his ability to eat and to grow and to have relationships and to have a fulfilling life, right? Like all of this stuff compounds. This middle bottom patient has lymphatic filariasis. Again, difficult to be productive, difficulty to feel good about your body, which is going to cause mental health issues, certainly in most persons, and not all. Some people, are like, who cares? Just legs, and great. But I think for most of us, if we looked down and these were our legs, and there was no way for us to get treatment, it would impact our day-to-day moving forward. And then this poor fellow here on the right has some undiagnosed nodular lesions that are really taking over his face and may cause him to be dismissed in his community, regardless of kind of who he is and how he's otherwise contributed. There's not too much more. I know we've crossed the 30-minute mark, but I just have a few more points I want to bring in. I talked about rabies not really being a thing, but that is going to cause behaviors in individuals, like what we'd see in dogs. But this is a guy who probably has an acute psychotic break, 21 years old, brought in by family to the Queen Elizabeth Central Hospital in Malawi, in Blantyre, was some kind of convoluted history. Maybe was bitten by a dog, has a history of substance use, was aggressive, reportedly biting people. And the differential, if you can see it, is psychosis, organic causes, rabies question mark. Rabies is super prevalent there, so it's okay to be on the differential, but probably not the issue. Probably this guy is mentally ill. You can see they've tied him down. This man was attacked and drug in by the community. He is one of the luckier ones. It's not uncommon if something like this happens that these people are really, abused, attacked, and as we know, again, from our experience in the US, we know that people who are mentally ill are less likely to be the aggressors of violence, but to be the recipients. And so this is just a case I wanted to highlight locally. So all of this stuff we've talked about, these demographic, economic, kind of community, environmental, social, cultural, all of this stuff. We talked about the environment, all of these inputs into good health and well-being. So these are the Millennial Development Goals. These are really, truly aspirational. I think, in the early days, maybe we thought we'd really get a lot of these cracked. I feel less hopeful moving into the future. But I still think that there is value in all of these. Will there ever be zero hunger and no poverty? I don't think so, but I think these are things that we seek to focus on. So, if we improve education, provision of energy, water, economic activity, gender equality, all of these things, this is going to improve the overall stability of a person's community where they live and work and have families. So each of these inputs is the cause of degradation of mental health, but can also be the drivers of mental wellness. And so, picking your favorite NGO or picking what area of global health you want to work in, you can be a driver for gender equity or, providing infrastructure to a community, clean water, sanitation, climate action, humanitarian relief, education, medical care. So all of these different things. And I know we didn't get a lot into like pharmacologics. Of course, 70 or more % of global anxiety could be mitigated with treatment. But the issue is really, political will and finances. So when you have a country that is, struggling to provide, day-to-day, basic functioning of government, looking at sort of a Maslow's hierarchy, like the top thing on their list isn't going to be anxiety treatment, therapy, benzodiazepines, SSRIs, those kinds of things. Like that is more kind of first world treatment. But, there's still opportunity to improve people's everyday experience that can help change that kind of local geography. And I don't just mean like, the actual environment itself, but kind of that whole kind of framework of what impacts an individual's day-to-day and what drives mental health and wellness. And so again, my email address is here at the very bottom. And this is just to show you kind of this framework again, how these different impacts can be used to drive movement forward in terms of improvement. And I think this is really, when we look at international and global mental health, these are the things that we can make a difference in, whether it's, providing funds to an NGO, we go ourselves and, provide our expertise to other clinicians to show them how we do things and learn from them about how they do things. There are some really inspiring clinics out there who are working on these areas and doing their very best without the available resources of medications and working with families to try to tackle some of these issues in very unique and creative ways. So, you know, with anything we do in the global spectrum, understanding that kind of the Western way isn't necessarily the best way, and looking towards these different social determinants and how we can be part of a solutions base for the different environments that deal with these issues. And again, you know, local is global and vice versa. So the things that we do here, the way that we talk about people who struggle with mental illness, the way that we approach our patients, and the way that we take our own implicit biases and our methodologies with us when we do work overseas um, makes a big difference as well. I've got some references here for you as well that I utilize. There's just so much information out here. And certainly if I can clarify anything further, you have any questions, or you would just like to touch base, more than welcome to contact me at my email address, airish@uiowa.edu. I hope that you have learned something useful from this, and I hope if nothing else, it gives you a little bit of food for thought in moving forward. So thank you so much for your time and attention. Take care.